and your favorite children's books read by your favorite celebrities. New Hampshire PBS has so much to discover anytime, anywhere, and for everyone. Go to nhpbs.org/learn-at-home.
This week on Granite State Challenge, it's the quarterfinals. The Plymouth Bobcats take on Manchester Central Little Green. Which team will advance to the semifinals? Find out Saturday at 6 on NHPBS.
You're watching viewer-supported New Hampshire PBS.
This is a production of WGBH2 Boston.
I'm Emily Rooney, and yes, this is Greater Boston with our temporary expansion to 5 nights a week. But we are still doing some Beat the Press-style media analysis, and we have a lot of it. A little later, some of our panelists will join me to talk about how Fox News has been backing those anti-shutdown protests, at least some of which have direct ties to the Trump campaign. Plus, after weeks of calling it a conspiracy that the virus may have somehow originated in a Chinese lab, some media outlets are legitimately looking into it. And journalists struggle to report from the front lines inside hospitals. But first, it was just last night that the president and his coronavirus team laid out a phased system to start reopening the country. It called for 3 tiers of reopening, each of which gets progressively more open, and each of which is not supposed to start until after 14 days of falling numbers of COVID-like and flu-like illnesses. It was also just last night that the president made this promise.
Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states. If they need to remain closed.
Joining us, polar opposites. Thanks so much. Turning now to some of the big media issues of the week. As we've reported before, Fox News first downplayed the seriousness of the virus, then changed their tune as infections surged. Now they're back at it, saying death and sickness projections are way overstated and taking sides with anti-shutdown protests this week. Protests that have apparent links to Trump's re-election campaign.
Chanting "Lock her up," several hundred protesters converged on Lansing, Michigan. It was a well-orchestrated pushback against stay-at-home orders, and one that caught the attention of the mainstream media.
Protesters at the Michigan State Capitol blasted the governor's strict stay-at-home order, which, among other things, even restricts interstate travel.
Putting all of these workers out of business.
While acknowledging people have the right to protest, Governor Gretchen Whitmer also noted the rally wasn't exactly nonpartisan.
It wasn't really about the stay-at-home order at all. It was essentially a political rally. A small group of people that came together without masks on, posters of being anti-choice.
And that's true. The Michigan Conservative Coalition has direct ties to the Trump campaign, and the governor noted most of the protesters weren't wearing masks and jumped out of cars even though they weren't supposed to. That didn't stop the commentators at Fox News, like Laura Ingraham, from backing the protesters. "Time to get your freedom back," she tweeted. And she interviewed one of the coalition members without mentioning the Trump ties.
Is there any fairness to that criticism that it wasn't a bipartisan group of people?
It's all part of Fox's Back to the Message mission, that Democrats and liberals want the country shut down in order to oust Trump. Last night, Ingram trotted out the non-medical Dr. Phil, who offered up these wildly inaccurate statistics just to make us realize we're acting foolishly.
45,000 people a year die from automobile accidents, 480,000 from cigarettes, 360,000 a year from swimming pools, but we don't shut the country down.
No, but we can turn you off, which is what the country needs to do.
I'm joined now by Joanna Weiss of Northeastern University's Experience Magazine and Tom Fiedler, formerly at Boston University. So, Joanna and Tom, one of the reasons why we keep talking about Fox is because they have a huge audience. People believe a lot of what they say. They hear Dr. Phil talk about more people drowning than that are dying of COVID, and then they give credence to this group that's largely sponsored by a group with ties to the Trump campaign. The mainstream media didn't really point that out either. But I mean, the question here is, how do you make people understand the seriousness of this when there was something they intentionally leaked out, but it was something it was sloppy, that somehow he contaminated one of the workers, and then the virus got out, and it was contagious, and that was the end. All right, well, moving on. Pulitzer Prize-winning New York Times columnist Nicholas Kristof has covered war in Iraq, the deadly crackdown in Tiananmen Square, and genocide in Darfur. But he said that this pandemic is different because so few have been able to report from the front lines. Kristof did end up getting access inside 2 hard-hit hospitals in the Bronx, along with a videographer, to show a rare look inside a situation he called particularly hell.
Someone codes, someone dies, you go on to the next patient. Someone codes, someone dies, you go on to the next patient.
I need a vent. I need a vent.
I need a ventilator.
This procedure spews virus into the air, leaving staff at enormous risk as they try to save the patient's life.
Every day you're thinking, am I going to get really sick? Am I going to be able to recover?
These doctors and nurses are risking their lives, and we're failing them. Some told me of their deep frustration with the government's response. We catastrophically bungled testing. The president dithered. Americans kept on partying. The result? Thousands of needless deaths.
Well, Joanna, this was an amazing bit of reporting, again, from Nicholas Kristof in the New York Times. But, you know, some doctors have been shooting their own videos, some nurses have, as we've said, but you can understand why these people would not want the media there for any number of reasons. They're in the way, they could be contagious, they could get something while they're there. So any frontline reporting like this is going to be tough to get.
It is very tough. That was a devastating video, and the accompanying column is worth a read as well. It really, I mean, if you have any temptation to go out and break any of the quarantine rules, this will disabuse you of it very quickly. It's tough because it really does bring home what's happening in a way that reporting from the outside, or frankly, Chris Cuomo talking about his symptoms out of his basement, doesn't do. And, you know, in the same way that historically we have had reporters embedded on the front lines of wars, I feel like it's necessary, and I think some hospitals and medical professionals are understanding that it's necessary. You just have to be super careful about the protecting the privacy of patients, which that video did very well, and protecting the safety of doctors and nurses and healthcare workers and journalists.
On the flip side of this, Tom, is that if they let the media in, it's going to, you know, tamp down the nonsense reporting on the places like Fox News, where you see that this is a reality. It's not like this in every hospital. That was New York City. It's not necessarily like that in every hospital in Massachusetts, but there are a lot of people in that kind of condition.
Yeah, I think the parallel that Joanna's drawing to war reporting and journalists being embedded with certain units is really a very good one. Many cases, military units, are uncomfortable with the idea, for a lot of reasons, of having a journalist with them. One of those reasons being that they may be exposed to more danger. But the reality is that people want good information. They want to be able to see what's happening and then make judgments. And I think it's important. It's difficult here because of HIPAA regulations, but nonetheless, I think, as a journalist, I believe that transparency is in the public interest. And we do need to see what's going on. We have to recognize the problem that we're facing and victims.
Mm-hmm. One of the things that struck me, Joanna, was keeping track of who is who. You know, we've seen these horrible stories about what's going on in nursing homes and senior facilities all around the country, and they're finding bodies stacked up. I mean, can you imagine just remembering who is who? You know, everybody's got these masks on, and you know, they're trying to shuffle patients who are most critical into the places where they need to be, and somebody is doing that like a juggling act.
Yeah, no, it would be reporting under extraordinary circumstances, and it's certainly healthcare work under extraordinary circumstances. And I think, you know, Nick Kristof in his piece made it very clear, you know, the heroic actions of these workers, the personal risk that they are taking because of their mission and their jobs. So it's not just a way to demonstrate the scope of this crisis, but it's really a way to really honor the people who are at the front lines.
Tom, final thoughts on that? I mean, it's, again, I'm not sure I'd want to volunteer for that assignment.
I think one of the things journalism does is it also humanizes the situation. It's no longer just the numbers every day that we see going up of the cases diagnosed and the deaths that go with it. These are people, the way Nicholas described it. You can see fear in their faces and fear in that faces of the relatives. And the doctors and the nurses and everyone else involved. That's the element I think it's really important for us to continue to have.
All right. Tom Fiedler, great to have you back. Joanna Weiss, good to see you as always, and hope to see you back in the studio here sometime soon. All right, that is it for tonight. Jim will be back next week. I'm Emily Rooney. Thanks for watching.
As the effects of this pandemic reach into every aspect of our lives, you can count on Greater Boston to bring you analysis and insight from the people you want to hear from: health experts, industry leaders, and the many people personally affected.
NHPR is your source for timely, reliable information regarding the coronavirus global pandemic and its impact in New Hampshire. I'm Jason Moon, health reporter for NHPR. Stay tuned for the latest news throughout the day, and head to nhpr.org for a live blog of updates, answers to frequently asked questions, and information from state health officials. Stay informed, stay connected with our continued coverage of the coronavirus on NHPR and at nhpr.org.